Young people aren't the only ones lagging behind the rest of the population when it comes to getting the COVID shot. So are nursing home workers, and it's a situation experts call alarming.
After COVID outbreaks were reported at 2 local nursing homes, Allie Peters took a closer look at vaccination numbers, and she joined us now. Allie, you found a huge difference in terms of who's getting the shot and who isn't.
Yeah, I found workers and at nursing homes and long-term care facilities aren't getting vaccinated nearly as much as residents are. In fact, at 2 local nursing homes, they recently reported outbreaks, and only 35 to 45% of staff had actually been vaccinated. So today I spoke to area doctors to find out why that might be. After COVID-19 outbreaks at Clifton Springs Nursing Home and DeMay Living Center in Newark, there are some concerns about vaccination rates among staff and residents.
Right now, our nursing home, those nursing homes are running a vaccination rate of employees between 35 and 45%.
For residents at the 2 nursing homes, that number is much higher.
Our resident vaccination rate is between 80 and 90%.
Now, this trend is actually not unusual across the state. I did my own digging into the state's nursing home vaccination numbers, specifically here in Monroe County. Out of the 34 nursing homes that self-reported vaccine numbers, 21 of them had less than 60% of their staff fully vaccinated. An area infectious disease expert says the concept of vaccinating staff is twofold.
One, you don't want to lose staff to illness and therefore have shortages, but very importantly is the effect that they will have on the residents of the nursing home or the long-term care facilities.
Dr. Walsh says it's important both employees and residents get vaccinated.
When you start to immunize your residents as well as the staff, the rates of COVID drop quite dramatically and really quite quickly.
As for why more staff members aren't getting vaccinated, doctors aren't sure, but they do say these employees get tested more often than most.
It's also important to remember that long-term care employees are tested twice a week. The general public is not tested at that rate. And long-term care employees wear personal protective equipment, masks, face shields, gloves, and so forth, all day.
Now, Dr. Walsh says it's equally important for family members and friends of those in nursing homes to get vaccinated as well. Now, if you haven't gotten the shot, he recommends not going to a nursing home. Live in Rochester, Allie Peters, News 8.
Thank you, Allie. When outbreaks do happen at nursing homes, they often have to pause visitations for family members and friends. Both Clifton Springs Nursing Home and DeMay Living Center currently are not taking visitors due to investigations and testing.